differences in first aid between adults, children, and infants. More specifically, these are the things that you do for children and infants in first aid. There are only actually a few things, especially with children. We're going to go over all of the major sections, but really the major stuff is in resuscitation specifically. So as a reminder, in first aid, your age range for the layperson, not for the health professional, is 0 to 1 years old is infant, 1 to 8 years old is child, and 8 and above is going to be adult. When you're looking at what you do differently, the biggest thing is going to be the size of the body, or the difference in size between the first aider and the person who is injured or the casualty. You could be doing child first aid on an adult if the difference in size is large enough. I am just over 6 feet tall. I have a fair amount of body mass. If I was to be doing first aid on somebody that was half my weight, I might be doing child-based modifications. So, for example, with choking, when you're doing responsive choking, so the person is able to cough, speak potentially, or maybe they have the full obstruction, but they're still conscious. If the person is half your height, you might have to get down on a knee in order to do back blows and abdominal thrusts. The height difference is the big thing there. This is the kind of stuff you're looking at. Before we get to resuscitation though, I want to go through each of the different sections and tell you what is different. Head and spinal injuries, there is no difference. It's the same as adult. With infant, they don't actually make any major distinction. There isn't much to stabilize. Infants don't really have necks. You're stabilizing a head in position found. There's no difference with head and spinal injuries at the intro first aid level. Wound care, burns, etc., there is no difference. With infants, there might be some little question as to how tight does the bandage have to be because they're so fragile in comparison to an adult, but in general there's no real difference in first aid for wound care. Same thing with burns, there's no difference. For poisons, there's no difference. You might not be able to get the same sort of information of did you put something in your mouth from an infant or an adult, for example, to say, did you eat a poison? The infant's not going to tell you, but as far as the first aid is concerned, treatment, there's no difference. Bone and joint, no difference. Multiple casualty management or triage, no difference. Chest injuries, no difference. There's the only real place there is a difference outside of resuscitation would be medical conditions where we're talking about specific medications. And then I suppose there would be some in heat injuries or temperature regulations. When dealing with medications with infants and children, there are small differences. Tylenol, otherwise known as acetaminophen, or another name that's used outside of Canada and some parts of Europe, so those are the names for it. Acetaminophen helps regulate body temperature. It's sometimes used in fever emergencies, and it's sometimes used for overheating in general. Usually it's used for fever emergencies when the body temperature gets too high. When you're looking at overheating, the normal safe heat range in adults, children, and infants can be off or different by about 1 to 2 degrees. So there's a small difference there, and Tylenol or acetaminophen being referenced is a thing. Aspirin or acetylsalic acid, ASA, is something that's often recommended for heart attacks. When aspirin is given to a child or an infant, it can cause Reye syndrome and kill them. So these two medications that are both painkillers, sometimes people will confuse them. One is for temperature control, the other is for heart attacks. The heart attack one is not to be used on a child or an infant. So that's one separation between adult and children and infants in first aid. Outside of that, and the age range thing, there's a slight consent difference technically too, because you might not be looking for the child's consent to do first aid. You might be looking for their parent or guardian's consent to do first aid. So there can be a small difference there, and that may change depending on what country you're in. So the whole consent conversation gets a bit more geographically dependent. It'll depend on where you are. So fine. Resuscitation. I'm going to go step by step each part because this can be quite different. Now, for children, most of this is the same. For infants, resuscitation is completely different. Well, okay, no, not completely different. There's one or two things that are the same, but the way you do it, the mechanics of it are different. So let's go over the stuff that's the same as adult. You're still doing 30 compressions to 2 ventilations as a ratio. That's the same for all age ranges. There will be a difference here at the healthcare provider level, but there isn't for the layperson. It's always 30 to 2. You don't have to worry about different numbers. As far as chest depth that's pressed down, it's always 1/3. Now, children and infants have smaller chests, so their 1/3 isn't as far, but the ratio is the same. So you're always going down 1/3 with compressions. That's the same. As far as the amount of air that needs to go into the lungs, you're still going until chest rises, but the lungs are smaller, especially in the case of infants. So with an adult, you might be going and doing a full breath. With an infant, and this is not a joke, the amount of air that you use is, it is a puff, because you don't need that much air to inflate an infant's lungs, and you don't want to basically take this balloon and just keep overinflating it. You don't want to just keep blasting air into this lung. It's not necessary. It can cause damage, etc. I would recommend that if you're going to learn how to do CPR on an infant especially, you definitely take a course that's specific to this so you can practice breathing into an infant mannequin. So you can kind of get a feel for how it feels to breathe into a lung that's that small. It's something that's easier to learn by doing. So just keep that in mind. I'm going to show you how to do this later in this video, but feeling this is helpful. The concept is the same of until the chest rises or the lung inflates, but the amount is different. As far as the pressure, I was saying, it's 1/3. What they'll often tell you to do in a first aid course is, CPR is 2 hands on an adult, 1 hand on a child, and then on an infant, it's completely different. I get why they say that. I don't personally prefer it, because the reality is that with my sort of strength level and just my body mass, if I was to do 1 hand CPR on a child, it would still probably be too much force. So it's more about getting comfortable realizing how much strength you need to compress a chest 1/3 and knowing when to stop. The trick though is, or the challenge is, most people won't go deep enough. So while I'm telling you, you don't want to go too far, I don't want you to get into this, okay, I don't want to press too much, and then you don't press far enough, and then you're not actually doing the compressions, right? So once again, this is one of those, it's probably a good idea for this specific thing to go work with an instructor, with a mannequin in the real world, and get that sort of direct feedback and feel what that amount of pressure feels like for you. It will probably be a bit easier. Sometimes in first aid courses, they'll have you use an adult mannequin to learn child CPR, and you're not getting the feedback you need, I would argue. It's very rare that you actually get child mannequins. They'll usually have adult mannequins and infant mannequins. This can be tricky to learn, but do your best. Once again, though, if you can kind of feel for eyeball what 1/3 of depth is, that's the goal. The 1/3 depth is the goal. Okay. Step by step with each thing. So choking, when you still do back blows, you still do abdominal thrusts. For children, it's the same. You might have to get down on a knee. It's the same. You still might get to chest thrusts. It's possible because of reasons. Who knows if there's some reason why you can't access the abdomen because they're in a chair or whatever. If for whatever reason you can't, then you can still go up and do chest thrusts. All the choking, responsive stuff is the same. For unresponsive choking, it's the same as adult, with the only exception being, once again, the amount of force on the compression. But other than that, adult and child resuscitation for that and that are identical. For defibrillation, there is one difference, which is significant. The pads, if you take out a defibrillator, the pads may say put one pad up here and one pad down here. Now, depending on how this video has been mirrored, this might look wrong, but this hand right here, the upper hand, is on my upper right side and my other hand is on my lower left side. So just so you get an idea, there's upper right and lower left. That is going to be where the pads would normally go on an adult. If you have infant pads and or child pads in the defibrillator kit, they will probably say put one pad front and back, the actual back, and you're shocking directly through the chest. You're not shocking across it. If they have child pads that say to put, upper right and lower left, fine, but usually it's front and back. If you don't have infant or child pads, you can use adult pads on the infant or child. You just put them front and back. You can put bigger pads on smaller bodies. Smaller pads don't generally work on bigger bodies, so you can just put adult on everything. Do not trim the pads so they fit. There's electrical wiring and stuff in there. Not a good idea. Just put like regular size front, back, no problem. But keep in mind that the space is different. Now, when you're doing defibrillation, if you could recall, and I'll probably put a video in for this after so you can see it. You're doing defibrillation, one person is doing compressions, let's say there's two people, the other person can put pads around them. You need to put one of these pads with a child or an infant underneath the hands of the person compressing, potentially, at least partially, and you need to put one of these pads on the underside of their body that is touching the ground. So this requires you to stop compressions and roll them and quickly put both pads on. It's a small little nuanced detail. Your compressions are interrupted, so you want to learn how to do this fast. And this is one of the reasons why children and infant CPR is usually taught in a slightly more advanced course, because there's just these little things. The defibrillation piece makes the child resuscitation slightly different, and infant resuscitation is a completely different period. So focusing on child, once again, the choking is the same. The resuscitation is the same except for the reduced force to compress the chest. And the defibrillation piece is different because of where the pads may need to go. Now we're going to have a magical cut to likely a table, because when we talk about infant, you're not going to be, you sometimes would work with the infant on your lap, sometimes you work on a table. You'll see why we're going to have a magical cut to a different section, because infant is a whole different conversation.